Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week, we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. This week, we continue our discussion of liposuction with Dr. Sessa, cutting deeper into the area of tummy tucks. Welcome back, Doctor. Nice
Thanks.
to see you.
Yeah.
Now, when somebody's considering this procedure of liposuction, when does it become something more than just that?
Yeah. So during my consultations, when somebody comes in for a liposuction consultation, the first thing I look at is I assess the quantity of fat and their skin elasticity. So as far as the quantity of fat goes, liposuction has its limits, and there's only so much we're allowed medically to take out safely, and also it has its limits in terms of the amount of contours. So so that's the first thing I assess. The second thing is the amount of skin, how the skin lies, and then I combine all of that with what the patient wishes and what they're looking for. So if they tell me, doctor, I don't care about the loose skin, I don't care if my skin looks crinkly, I'm 70 years old, I just want to fit in a dress, I just want to feel more comfortable, then it's liposuction.
Okay.
If they say, no, I wear my bathing suit a lot, I work out a lot, I'm tired of having this skin and fat down here, then it's something more involved.
Okay.
The liposuction tummy tuck is great procedure for that, because once I do the liposuction and I'll flatten out the tummy, the hips, the flanks, really bring in your waist, there's going to be a lot of loose skin left over.
Sure.
It's just not going to contract properly. So it's much better if I could just remove that skin from your belly button down, and so it comes out in like an ellipse, like a big football, if you will.
Yep.
So it comes across all the way down, so it's like a big diamond.
Yep.
And all that skin gets removed, as well as the fat. And then we pull the skin down. If the muscle needs to be tightened, because when you've had children, it's splayed your muscles apart, we could take care of that at the same time. And that has a flattening effect on your belly.
Okay.
And when I do that, the final result is transformative. Those are the types of procedures where you see big changes.
Instantly.
Yeah,
Really.
big changes. Instantly, of course, but then generally it takes about a month to 6 weeks before everything really contracts in. The fat that hasn't been sucked out gets dissolved, removed by your natural processes in your body. And that's where you really see the sort of, wow, what a transformation.
Okay. Now, a lot of people exercise and still have this problem.
Yeah.
So what are the benefits for them? Obviously, I mean, they're going to see these fabulous results, but they're still going to have great muscle tone. You're just going to give them more definition?
Yeah.
Or?
So really depends on the amount of loose skin that they have.
Okay.
So if I'm grabbing the skin and I'm pinching the skin, if you just have a little bit of loose skin above your belly button or a little bit below, tummy tuck's probably not going to do it for you. Although a mini tummy tuck with a much shorter scar and some liposuction might be the trick. Or you may settle for a non-surgical procedure, which I have a device called the Vanquish at my office, which FDA approved to melt fat on your stomach and your hips, as well as tighten skin, non-surgical, but not to the extent that you would see with surgical procedure. So it depends on what your goals are, what you're looking to do, how active you are, your body type, the condition of your skin. Has a lot to do with the treatment plan that I'm going to put forth.
Now, who is a possible candidate for the one that you just mentioned, the one that's non-invasive?
So if you have sort of pockets of fat or a little pooch or a little bit of loose skin associated with a little bit of fat, non-surgical is great. If you have kind of a big tummy and you could squeeze, if you could do that, non-surgical treatments are probably going to fall short unless you're looking for 15%, 20% improvement. 15 to 20% non-surgical, 85 to 90 to 100% is surgery.
Okay.
And
now,
it's all permanent.
sorry. Okay.
Yeah.
Now, when you remove the fat,
Yeah.
What kind of volume are we talking about? You said there was a certain amount that was prescribed.
So a couple of things about that. So the Board of Medicine sort of in Florida is very active. And they made sort of general regulations where you should not go over 4 liters of removal for a single liposuction procedure. Now that might change if you perform the surgery within a hospital. They have sort of a little bit less strict standards. But as far as safety goes, and as far as if you do a literature review, and 4 liters is a very safe amount that you could remove from someone and not run into potential issues medically. Because no one wants that.
No.
You know, this is elective cosmetic surgery.
Sure. Now, for those who aren't familiar with the metric system, what is a liter equivalent to?
So a liter,
quart, half gallon.
You got me on that one. You know, I know it in cc's. A liter is 1,000, is roughly 750 cc's, but I'm pretty sure that there in a gallon there's a little bit more than 4 liters.
Okay,
in a gallon.
so roughly that's about how much.
It's a little bit less than a quart.
Okay, and pounds. Do you lose weight as well when you have this removed?
So every 400 cc's is about a pound. So my average liposuction case is probably about 2,000 cc's, maybe 2,500. And if I'm doing a lipo tummy tuck, it's generally 4 liters.
Okay, so that's huge amount of fat to get rid of.
Big changes. Yeah.
Awesome. Well, thank you again, and we'll see you next week.
Thank you.
Thank you. Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Returning to the studio from Sarasota Vascular Specialists is Dr. Sampson to talk about aortic aneurysms. Hello, doctor.
Hi.
Feels like we're old friends. Yes, I like that. I like that. Can you tell us what aneurysms are? Is there a number of different types of aneurysms?
There are a number, so I'm going to be talking about one specific type. But an aneurysm is any bulging of an artery. So we've spoken about arteries that take blood away from the heart. They're normally just narrow tubes. When they weaken, they blow out like a balloon. So an aneurysm is a ballooning of an artery. So there are arteries that can be an aneurysm in the brain. I don't talk about that because that's a completely different condition. Neurosurgeons deal with that. But there are certain sites of the body where these other aneurysms can happen, and the main area is in so-called the aorta. That's the main big artery that comes out of the heart, goes through the chest, down through the abdomen towards the legs. And the main area where people tend to get aneurysms is as that main artery goes into the abdominal region, it's an area where it starts to balloon out.
So is it harder to notice or feel? I mean, I would think if something was bulging out that you would see it, but in your abdominal cavity, you don't know whether
You're 100% right. People don't know they even have it because it's completely asymptomatic. In other words, it sits there and starts to balloon out and the patient doesn't feel a thing. And then all of a sudden it gets to a size where it's so big that it bursts. And then all the blood comes rushing out into the abdominal cavity, and that's usually fatal. So in other words, it happens so quickly that some patients don't even know they had it, and they may be diagnosed as having had a heart attack and just dying on the spot. But other people will have severe abdominal pain, really severe abdominal pain, back pain. They come rushing into the emergency room with low blood pressure. They're obviously terribly ill, and then we have to rush them to surgery. So what's important with an aneurysm is to find it before it ruptures, and that's the whole key here.
Okay. Well, and again, since you said they're so hard, symptoms, what are the symptoms?
None. No symptoms.
No symptoms?
No, none at all.
Oh my gosh.
So they're picked up in the abdominal cavity by a good doctor. When you go for your physical, we are talking about aging gracefully. This is really a condition of older people. So when you go for your physical, the doctor will put their hands on your tummy And if they feel this kind of this pulse that's abnormal, they'll send the patient to a vascular surgeon for a checkup. Sometimes they're just found by chance. So the patient has some abdominal discomfort. For some other reason, they get an ultrasound or they get a CAT scan. Lo and behold, there's an aneurysm. So then they are referred to us.
Okay. And what types of treatments do you use?
So the important thing here, small aneurysms are very unlikely to rupture. So it's just like a balloon. When you blow up a balloon, you don't expect it to just burst as you're blowing it up. Of course it can. But as it gets bigger. So what we do is either on a CAT scan, which is really just a fancy x-ray, or an ultrasound, we measure the aneurysm, and if it's greater than 5.5 centimeters, which is a little bit about the same size as this artificial fruit, if it gets to that size, then we would do something to fix it.
Okay. And what types of treatments are there?
So in the old days, which is even now to tell you the truth, the main way of doing it was a big open operation. Go to sleep, cut the abdomen open, cut out the aneurysm and replace it. That's about 6 days in the hospital, recuperating at home, and about 2% of people actually die from the surgery. But fortunately, over the last 15 or so years, we've had a new way of doing it where we go in through the groin and we actually put an artificial artery inside the aneurysm, much like an inner tube in a tire. And we do that through a little puncture wound in the groin. And that's an overnight stay in the hospital and home the next day. It's been a major advance.
So what that does is, overrides the aneurysm, and what happens to all the blood that's been in that
You're very good at your question. So what happens is you've got this inner tube, and so the blood's going in the inner tube, but there's this sac of normal blood vessel around it. Well, that blood gets trapped and just forms a clot. And the clot just stays there, and slowly the body absorbs it, and the aneurysm goes away.
Okay, and it dries up, basically.
And it dries up, basically, and goes away.
All right.
So another place where you can get an aneurysm is in the chest, where the artery comes out. Now, that's very hard to diagnose because nobody can feel through your rib cage and see you've got an aneurysm. So that is usually found by chance on a chest x-ray or in someone that may have had a history of aneurysms. Now, there's one other aneurysm I'd like to speak about, and that's called a dissecting aneurysm. And that's a condition where people who have very, very high blood pressure, something maybe like 200 over 100, will suddenly get a tear in the main artery. And they get tremendous sudden chest pain in the chest. And the blood goes down the wall of the artery, and then it kind of blocks the artery off, and that can cause circulation trouble and also sudden death. So that happened to John Ritter, the famous actor from, TV actor. So again, if you get sudden severe chest pain, that's not necessarily a heart attack. But if you have it and you're in that situation, again, the emergency room is the safest place to be.
Okay. And again, go to a specialist because not all physicians, surgeons are able to treat aneurysms?
Most aneurysms are treated by vascular surgeons. There are some other specialists that get involved with it, but usually the people that do the most of these are so-called vascular surgeons that are board certified by the American Board of Surgery with special qualifications in vascular surgery.
Okay. Well, again, always nice to see you, and
thank you for the invite.
See you again.
Sure.
Thank you, Doctor. Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Our next topic of discussion includes biopuncture and hypnobirthing. Dr. Jessica Lippam returns in the studio today to tell us more about these. Welcome back.
Thank you again, Nancy.
These are two things I am not familiar with at all. So why don't we start? What is biopuncture?
Biopuncture. It is injecting sterile solution into acupoints to enhance the effect of the acupuncture.
Okay, what is that?
Different sterile solutions that we might inject would be things like arnica. You've heard of arnica before? So there's an injectable solution called Tramiel. It works great for joint issues that aren't having your regular results with acupuncture. So I'll usually always just do the traditional techniques first, and when we don't have the results we're expecting, I'll introduce biopuncture to someone, see if they're open to it.
Okay.
We always do a tiny little bleb under the hand just to make sure they're not going to have any kind of topical reaction, allergy type reaction to it. And then it's a really simple process, and people have really great results. I've had a couple patients who've done almost everything, one of them including back surgery, and he still gets best pain relief with acupuncture and biopuncture.
Okay. So those would be great things to try again, whether it's your hips or your knees, any kind of joint pain. There again are natural ways that you can
help the body figure out how to heal itself better.
Okay.
And I usually will describe the fact that these solutions have almost every nutrient that the body needs to rebuild, rather than sometimes we'll use corticosteroid because we just want to stop the pain.
Right.
But we're finding more and more now, even with that, that it hinders the body's ability to heal at that time frame. So I'm not sure how real helpful it is.
Okay. And again, you know, our bodies, as we age, it's, you know, I use this scenario, you know, you're like a car, you're getting older, things are wearing out. You know, you have to replace them. It's not so easy with the human body, but if you can give it back what it's lost, which is what you do, is wonderful.
Well, and oftentimes I'm happy that you use the car, because I will usually use the car as an example. People treat their cars better than they do their own bodies oftentimes. They know they need to have their 60,000-mile tune-up, but they don't often do that for their self.
For their oil changed, you know?
Right, for their own bodies. So I encourage that.
Okay, and then what is hypnobirthing?
Hypnobirthing, totally different subject. So I was trained by Marie Mongan. She is the woman who came up with the concept of hypnobirthing. She was a hypnotherapist, and it's really based on the fact that throughout history, especially in the United States, we have these myths about birthing having to be horribly painful, and through movies and familial stories, oftentimes you hear the worst aspects, not the best, not the fact that you truly can have a gentle, calm, relaxing birth. And oftentimes hypnobirthing babies are easier to sleep, easier to get into routines, have a much calmer affect about them, just way more chill mood-wise for babies.
So would a woman start coming to see you then when she first becomes pregnant?
Great question. I usually suggest within the 5th or 6th month. And the other thing that really drew me to want to teach the class is that I used hypnobirthing for my children, birthing my children. Both were birthed at home. And the hypnobirthing class includes the birthing partner or the dad. 100%, where oftentimes we don't really have a job for them. And they're empowered in that they know how to cue the birthing mother to get back into that deep place of relaxation, so that all she has to do is breathe and allow the birthing process to happen.
So there's no herbs or anything used in conjunction with this? It's a technique.
It's a technique, and we have 5 about 2.5-hour classes that we meet, and we kind of call it training. So in these training classes, I talk them into deep states of relaxation. I'm not a hypnotherapist, I'm not hypnotizing anyone, but through these scripts that Marie Mongan has put together for the class, we start to speak directly to the subconscious and train the mom that she has the ability to reach these deep states of relaxation through the process.
Okay. Now, I know we've talked about a few different things over the past few weeks here. One of them was the suggestions that you had to be proactive about, you know, again, we're all talking about aging gracefully, and we know that our cognitive ability declines as we age. Do you have any suggestions for that?
I'm sure that you could imagine what my first answer is going to be.
Water.
It is.
Water.
It's water. Our cells are 70 to 80% water.
Yeah.
If we starve them, they don't function proper, and it just starts pulling from the inside before it pulls from the outside. So I often tell people, if you're experiencing dry lips and dry skin, then you're already dehydrated. Think about what's happening on the inside.
You're shriveling up, basically.
You just shrivel right up. And the brain, we know the brain is two main parts of material, to keep it simple: water and essential fatty acids. So secondly, of course, the krill oil.
Yeah.
I haven't found information anywhere ever on a human being overdosing on essential fatty acids.
Okay.
That's how essential they are to us.
Okay.
And then coconut oil, again, there's studies on coconut oil. Even just a tablespoon of coconut oil can really help plateau cognitive decline.
Okay. You know, I'd like to finish up with, you know, again, so many aspects of what you do. It's not just acupuncture.
Right.
You really treat the whole body. Acupuncture's for part of it. You know, you also do cupping. And what is the difference? When do you integrate that, or are they two separate things?
They
Doctor?
can be separate. Oftentimes I use them together. I'll use them for people that have tension in muscles that won't release just simply with the acupuncture and the heat. And I know cupping got a lot of press with Michael Phelps and the recent Olympics, but what you saw there were stationary cup marks. So I do a variety of cupping that's quite different than just sticking them on the trigger points to release them. I do something called moving cups. And so oftentimes I'll do acupuncture, have heat on the body, and when the acupuncture is done, I'll pull the pins, and then I'll put a little bit of, I call it secret sauce, but one of my salves that has healing properties, and then put the cups on and move them. We know where and how the muscles go from an anatomy perspective, and so you go with the muscle fiber and then across it, and it's almost like combing out the knots and things, and what we're accessing is the fascia. And again, we're finding all kinds of really great things coming to light with research on fascia. They used to just call it this network webbing that held the muscles together, but now they're actually seeing that it carries information, old traumas, old stories, and emotions. So if we can liberate that stuckness by lifting and separating the tissue, I've found it does much more, gives more relief than massage.
And that's it. You know, you feel so good from massage, but this is more an internal pulling things out.
And it
and
would then allow
stimulating
your massage therapist to get deeper.
Awesome. Okay. Wonderful. Well, I've so enjoyed having you here today.
Thank you for having me.
And I've learned a lot of new things and revisited old things that I really, really appreciate you sharing with everybody today.
Thanks again.
Thanks, Doctor.
Thank you for watching this season of Aging Gracefully on Suncoast FYI. We'll return in the fall with more tips on how to live a happy and healthier life. See you in September.